Eating disorder. Not the same as disordered eating. Examples are anorexia nervosa, bulimia nervosa, and binge eating. It includes a spectrum of continual stress and emotional anxiety. For some, food is a source of continual stress and anxiety. Anorexia nervosa. It is a self-imposed starvation syndrome triggered by a severely distorted body image. It occurs at the self-starvation end of the continuum. It can also involve purging and exercising excessively. Binge eating disorder. It is formally known as compulsive overeating, when people chronically consume massive quantities of food. It is triggered by emotions, frustration, anger, depression, and anxiety. Bulimia nervosa. It is when people completely gorge themselves, resulting to purging to reach their goal, which would be to be skinny. They make themselves vomit, take laxatives, and exercise excessively. Most people suffer from binge eating at one point in their life. Causes are rooted to psychological, biological, and culture. Those who suffer from depression also have an increased risk of eating disorders. It can also be caused socially and by society's emphasis on extreme thinness. This causes also, especially in women who feel socially pressured, as well as body dissatisfaction, commonly among adolescent girls. More than 50% of bulimic anorexia and anorexic suffer from PSD. PSD is post-traumatic stress disorder.
Anorexia nervosa affects about 1 in 200 women, usually starting in adolescence. Its meaning of nervous loss of appetite is misleading. They're obsessed with food, but their obsession to be thin is greater. The peak ages are 15 to 19 and typically young middle class white women, prevalent in women who participate in activities that emphasize leanness. What causes anorexia nervosa, and are there any warning signs? It can be the result of a weight loss program gone airy, avoidance of particular foods, unconventional food choices, or a rigorous exercise routine. To suppress hunger, they may drink up to 30 cups of diet soda or water a day. No matter how thin they are, they still see themselves as overweight. Treatment. There is no single way to cure it. It requires collaborative approach by psychological, nutritional, and medical specialists. Most patients achieve normal weight by intensive therapy, and the longer someone suffers before receiving treatment, the poorer the chances of completing recovery. 30 to 50% of anorexia patients also have symptoms of bulimia, complicating diagnosis and treatment. The ones who have other emotional disorders are the most likely to die from complications of this disease. The first goal of treatment is to stabilize the patient's physical condition, and the second goal of treatment is to convert the patient into a willing participant of treatment.
The term bulimia is used to describe binging and purging. To binge means consuming very large amounts of food at a period of time, while purging is self-induced vomiting or misuse of laxatives. People who are bulimic tend to obsess over foods, but yet they are repulsed by gaining weight. People who suffer from bulimia may have experienced a lack of nurture and ate for comfort. The behavior may have started as a coping mechanism. Depression, low self esteem, and unhealthy relationships may also be factors. There are many things that may trigger the urge to binge. Just being in a new environment such as college may produce the urge. Bulimics spend hours planning and fighting their next binge. One thought can evolve into a whole binge episode. Purging after these consumptions can lead to problems such as irregular heartbeats and intestinal issues. Discovering someone is bulimic can be quite difficult because their behavior has changed from being very secretive and their body weight looks to be normal or near normal. Binging and uncontrollable eating has been one warning sign, as well as being obsessed with body weight, having dental problems, as well as issues in the family or just at home. There has been minimum research in bulimia. Studies have shown it is easier to treat rather than anorexia because patients are more aware of their behaviors. Therapy and support group minimizes relapses, and with treatment, more than half shows improvement. When having bulimia, there are many side effects that can occur. Gastrointestinal, meaning there are problems in the stomach and intestines, weakness and fatigue, seizures, and tooth decay, may all be because your body is constantly vomiting.
Binge eating disorder is the most common eating disorder in industrialized nations. Causes are to nurture or reduce stress with food. They eat excessive quantities of food but do not purge. They begin dieting young but don't start binging until adolescence. Who does this affect and why? Stress and conflict often trigger binge eating. It can be a learned response to stress or conflict. More than 50% of these people have clinical depression. They usually haven't learned to express or acknowledge their feelings, and instead of acknowledging their feelings, they eat them. How do you treat this disorder? Therapy helps to identify and cope with buried emotions. Learn to separate biological hunger from emotional hunger, and antidepressants can reduce the urge to binge by altering the brain serotonin level. Body dysmorphic disorder, also known as BDD. These people are preoccupied with an imagined or slight defect in appearance. The preoccupation can cause significant distress and impairment. They may engage in long rituals of grooming, and it accounts for approximately 2 to 7% of plastic surgery patients. Who is affected and how do we treat it? It affects 1 or 2% of the general population, but frequently goes undiagnosed. Seek psychiatric treatment to decrease symptoms. Therapy helps to resist compulsive BDD behaviors. And SSRIs can relieve obsession and decrease distress and depression. Night eating syndrome constitutes of waking out of your sleep to eat or midnight refrigerator raids. Fairly uncommon eating disorder amongst the general population. Only affects about 1 to 2% of adults and a quarter of obese people. What causes this and how do we treat it? It's a combination of biological, genetic, and emotional factors. Stress, depression, and anxiety commonly affect their mood. These people can attend stress reduction programs and develop a meal plan that will distribute your intake evenly. Eating disorders do not just affect females. Eating disorders affect 1 million boys and men in the U.S. Most men with these diseases are overweight. The male concerns are shape and muscle definition as opposed to their weight. The disorders often develop as they try to improve their athletic performance. So, why are women more susceptible to developing eating disorders? There's a sociocultural pressure for women to be thin. Advertisements that promote dieting target young women. Women are more likely to alter their eating habits to achieve their desired appearance. And the desirable thickness for women is 15% below a healthy body weight.
Hi, my name is Casey Link, and I'll be talking to you about eating disorders and how to prevent them. So first, I'd like to begin with anorexia athletica, which is an eating disorder associated with competitive participation in athletic activity. There is a correlation between eating disorders and excessive physical activity demanded during sports training. Lean sports that focus on mostly body image, like distance running, gymnastics, and dance, increase the risk for an eating disorder. Young females that play sports or exercise intensely are at risk for female athlete triad, which is a syndrome in young females that fall into three categories: disordered eating, amenorrhea, which is the absence of menstrual periods, and osteoporosis, which is lowered bone density. The females who are at risk for this syndrome are females who compete in endurance sports like long distance running, wrestling, or even indoor rock climbing. Now, triad factor number 1 is disordered eating. When athletes try to lose weight as a way to improve their performance, they may be putting themselves at risk for disordered eating. Research suggests that female athletes are at a greater risk for disordered eating than females not involved with an athletic program. Now, triad factor number 2 is amenorrhea, which is the absence or irregular occurrence of a woman's menstrual cycle. 2 to 5% of women have amenorrhea, but of course the prevalence is higher in athletes. Amenorrhea in athletic women is related to the combined effects of increased physical activity, weight loss, and low body fat levels. Many female athletes who suffer from this triad have decreased bone density, which leads me into triad number 3, premature osteoporosis. Premature osteoporosis or lowered bone density is common for females who are amenorrheic athletes. Research shows that the rapid loss of bone density, which starts in the spine, can spread. Treatment involves replacing estrogen, which is low in amenorrheic females, and calcium supplements are also suggested. Although bones may never be normal again, studies indicate that reducing intensity of training, improving dietary intake, and increasing body weight can help restore administration and increase bone density. Pregorexia is another eating disorder. It's a term to describe pregnant women who reduce calorie intake and exercise in excess in effort to control the weight gain during pregnancy. Now, many women gain too much weight while pregnant, but women who struggle with body image prior to becoming pregnant can need special attention, care, and recommendations. Infantile anorexia is exactly what it sounds like. It is severe feeding difficulties that begin with the introduction of solid foods to infants. Symptoms include constant food refusal for more than 1 month, malnutrition, and parental concern about the child's poor food intake. Infantile anorexia should not get confused with picky eaters. Picky eaters have strong food likes and dislikes but are not malnourished. Infantile anorexia has very serious consequences. Malnutrition can impair brain development and can cause a lifelong unhealthy relationship with food. Although eating disorders are difficult to treat, it is possible. Preventing eating disorders are what experts emphasize on. Preventing disorders depends on establishing mind, body, and food relationships. Intuitive eating is following the body's signals. In order to combat disordered eating, it is important to de-emphasize body weight, treat each athlete individually, and facilitate healthy weight management. Some ways to improve intuitive eating is to respect your fullness, which means not to overeat. Respect your body, exercise, and honor your health. These are all ways to prevent any eating disorder. Eat smart, and thank you for listening.